Let's get started with session 6 about health of indigenous people in Latin America. We are excited and honored to be joined by Mirna Cunningham Kain, first Vice President of the Board of Directors, Indigenous Fund for the Development of Indigenous People of Latin America and the Caribbean, FILAC. She will be moderating the session, and we will also have as a speaker Dr. Sandra Del Pino, Advisor of Cultural Diversity for Pan American Health Organization, PAHO, and University Communication and Health Coordinator of the Indigenous Organizations of the Amazon Basin. You can find their full biographies on the official First Virtual Latin America Patients Congress page on IAPA's website. Before we get started, remember you can use the Q&A tab, but we'll have a session later. Now I invite Mirna Cunningham Kain, our moderator, to take the floor. Thank you, dear Estefania. Speaking in an indigenous language. I'm representing my own group, indigenous group in Nicaragua, and I want to express my gratitude to this invitation and to my specific fund to be part of this activity. I'm speaking on behalf of the Fund for the Development of Indigenous People of Latin America and the Caribbean, which is an intergovernmental organism that has 30 years of existence. The main characteristic of our fund is that we have a governance model that is equal to the indigenous group and the other governments in the region. We have the order to contribute with self-development of indigenous people in this region. And this framework we have been working throughout last years together with the Pan American Health Organization and the Organization of Indigenous People with different state members in order to transform health systems in the region, intercultural health system, to acknowledge and respect the cultural diversity of the region. That way, health services could be delivered as a response to the specific culture of each one of the people using those services. The pandemic of COVID-19 proved us that health and the health system in different indigenous people are fundamental in order to make sure we can deliver real assistance and a pertinent assistance as well. In this regard, it will be very important to hear to our panelists' speeches. Now, I turn the floor to Dr. Sandra Del Pino to share with us the whole program of the Pan American Health Organization before and PAHO in order to move forward to the different cultural organization movements. Welcome, Sandra. It's a great pleasure to have you here. Thank you very much, Mirna. I'm honored. I'm speaking on behalf of the Pan American Health Organization, and it's a great honor to be here in the first virtual Latin American Patients Congress. I'd like to congratulate you because you included such an important topic, which is health of indigenous groups. Next slide, please. I will share an overview on how the Pan American Health Organization has been working so far regarding this topic. We started in the 90s due to the SAPIA initiative, due to its acronym in Spanish for the well-being of indigenous people. And we also had the regional office of the WHO for the America. They considered that it was important to have a specific approach regarding health of indigenous group in the region. Starting there, we issued some relevant resolutions that are still applicable nowadays. Of course, it was not an easy path. we were facing different challenges. We know that this region, specifically in Latin America, it's very diverse and also with a lot of cultural wellness, but also with many differences among the countries and within a specific country. There is also another regulatory expression in 2010 was approved for the very first time a resolution on human rights and health rights by the WHO. And it's very important because member states agreed to respect the regional and international legislation linked to health and rights. Of course, this is applicable as well to Indigenous people. I believe it's very important to highlight the work towards universal access to health and universal coverage to health. It was something very important that we were able to achieve, and we talked about the need of adopting specific approaches towards satisfying the needs of Indigenous people and Afro-descendant people. We have also the current strategic plan of Pan American Health Organization from 2020 to 2025 that includes cross access. This is very important because the regional office of the WHO allows this, and these allow us to include other groups with cultural diversity. The other parts of WHO work with other axes, which are gender equity and human rights, but in the case of the WHO, we include other topics that are very important. Next slide, please. And also, in 2017, we approved the first policy about ethnicity and health. It was a long process of consultation. It's not only focusing on Indigenous people because it involved also other groups, other groups, Afro-descendants, and other ethnic groups. But it was very important to have this consultation process because it was held during different years. And it's a very singular policy. We don't have any other policy like that in the United Nations system, nor in the framework of the World Health Organization. And let me talk a little bit about cultural diversity and how it's addressed in this policy. We need to talk about social determinants in terms of health and all the challenges that Indigenous people are facing are in many occasions triggered by racism and discrimination situations. And of course, those situations will have impact on the lives of those people throughout their whole life. The policy, ethnicity and health that has been held by the PAHO consider as well the importance of positioning culture and traditional knowledge, as well as knowledge from ancestors, as something that could improve their health and contribute to their health. This is very important because that way you can realize that when talking about technical cooperation, the WHO can deliver some solutions for the needs. In this regard, knowledge and culture is very important, and we need to highlight that every decision-making process regarding health problems or issues that impact Indigenous people should be linked and should be tackled by their leaders and authorities. Next slide. Policy about ethnicity and health was approved in 2017, and we had 5 strategic lines. Next slide, please. As I mentioned, we have 5 strategic lines that will explain how we should cooperate technically when we are addressing the well-being and the health of Indigenous people. And let me tell you something, those 5 priorities were established by representatives of Indigenous people in those consultation meetings. Those 5 strategic lines are also related to non-communicable diseases. which is the topic we're going to address today. Of course, it's a generic framework, but could be applicable to any other health related topic. The representatives of indigenous people identified that they, in many occasions, cannot understand which are the epidemiologic patterns, and it's quite hard to promote initiatives that are consequent to the needs of the population if we don't have data. That's why one of the most important strategic lines it's about emphasizing data, and we work very closely with the Fund for the Development of Indigenous People, FILAC, for its acronym in Spanish, and my colleague Mirna in order to promote such a critical topic. Other technical cooperation that we do a lot, it's about impulsing intercultural health policies. This is also very important for our region here in Latin America, as we have a very wide variety of groups that in many occasions is not reflected in health systems. Another strategic line, it's about participation, social participation indeed, and strategic alliances with the indigenous people. Here, it is crucial to remember that PAHO has a cooperation agreement with FILAC to work in the development of the indigenous people of Latin America and the Caribbean, and we were able to start some initiatives together. An initiative should be work together with indigenous people. Fourth, it's about recognition of knowledge from ancestors and traditional medicine as well as complementary medicine. This was also considered as a priority ACEs to work in our region. And finally, the fifth, the strategic one, it's about capabilities development at all levels. When talking about interculturality, not only talking about high levels at health ministries such as promoting interculturality in health in local contexts, and the health workers providing services to indigenous people, and also indigenous people should take part in the health sector as superior education, as university careers. Now, the whole technical cooperation is led by those topics, and we shouldn't forget about non-communicable diseases. In 2019, a specific strategical plan was approved about the following up of this health plan. Right now, we are gathering information about the indicators of the strategic plan because we need to prepare a progress report in 2023, I mean next year. This action plan will include 3 impact indicators, one about reduction of mother mortality, one about childhood mortality, and another one about the cases of tuberculosis in different indigenous people. Finally, I'd like to mention that those 5 lines are the ones that lead the ongoing work with other initiatives. So there are another initiatives from PAHO that are now being tackled here and are not only focusing on indigenous people, but we were able to work with this in other countries that we have a lot of indigenous groups. For example, there is an initiative called Hearts, articulated by Health Ministry with the participation of different local actors that aims to integrate the different health systems that are already existing with the adoption of best global practices in prevention and control of cardiological diseases. Ecuador is one of the countries that started to use this. Bolivia as well, it's another example, and in that case, FILAC was able to start a project with the support of PAHO with technical cooperation about diabetes and indigenous people, emphasizing specifically in the Quechua and Aymara population. And we hope that we can expand this work to other countries and continue working with our colleagues in FILAC. It's a very important topic, and in order to wrap up, let me share you some final thoughts. We knew before that indigenous people also talked about or suffered some topics such as diabetes, hypertension, specifically in elderly people, and those conditions made them more vulnerable to the consequences of the pandemic of COVID-19 comorbidities. And this is also a very important linkage because they started to fit themselves with Occidental West food habits. And of course, the pandemic made this visible, the inequalities and the vulnerabilities, of course. And at the same time, I believe that the pandemic forced us to start thinking about how relevant it is to continue working with Indigenous people because they are resilient people. Considering some of the recommendations that we would like to express on this panel, I should highlight the importance of translating not only speaking in terms of languages, but also in terms of culture, some of the initiatives we're working on because we need to adapt to the context of Indigenous people in our region. And we should continue working with the leadership in those topics and also maximize the efforts of the agencies. Right now, I believe that the agencies that are part of the system are overloaded because the pandemic brought huge loads of work and there are many important efforts linked to health sector and it's important to maximize and get the most of our efforts. We should work together and we should face a collective and individual approach as PAHO promoted. We do believe that this is the way to go. And also we should boost methodologies that can help us to understand the different cosmovisions and the different behaviors that some communities are expressing in order to understand which are the most successful interventions. In this regard, tomorrow, PAHO and FILAC will launch a methodology on dialogues and knowledge to work in the health sector. So I will invite you to be a part of this. Thank you very much, Mirna.
Thank you so much, Dr. Sandra, for sharing this with me. I remember the Winnipeg session in 1993 when we started this process. And we were with a colleague, which was an indigenous doctor from the Amazon. And we've been working all together to achieve the results that Sandra Del Pino shared with us today. When we talk about Indigenous people, I would like to highlight that today we are all once again talking about the criminalization of the fight of Indigenous people and Amazonia. I want to remember Bruno, Pereira, and many of them that are part of Amazonia. Many people that with their lives are contributing and helping us to show the importance of the work that we do all together. The impact of colonization on the different structures and social issues that Sandra mentioned are so important. Young people from indigenous communities, they always remind us the impact that the pandemic had on their mental health, for example, to name some gaps that they are facing. So now they became more visible because of the pandemic. And now we are going to listen to Irvin Risti from Coloca. Then, as I said before, Coloca has been working with us since 1993, and I'm sure that Irvin is going to contribute with this. He's going to talk about how Indigenous people are collaborating.
Yes, good morning, everybody, or good afternoon, good evening. for the different timelines in our country or in our world. But yes, thank you again for your invitation. It's really an honor and a pleasure to be part of this platform also. And thank you for the introduction. I greet you from Suriname out. I'm based here in my country. Since the pandemic had hit us, it was really quite a challenge to work now from a distance because the structure of Koika is a bit more of a lot of face-to-face meetings, and yeah, that had enormously had put a pressure on our way of communicating. And yeah, it was really a success at the end. So I want to dive into my presentation. So the most important thing is that we have as indigenous that are living Amazon save humanity. So that's our really one of our motto and also one of our inspiration word that we have learned from our ancestors. So that's one of the main thing. Next slide, please. So Koika is structured in 9 different countries in the Amazon basin, as you could see here. These different organizations make the form of Koika, and mostly regional topics, international topics, problems, and also solutions. With the ancestor knowledge that we have for many generation, we find now this is the point now, the tipping point also in our way of living as humans, and these organizations really strive for better solutions, and in each country they have their own program, their own method of implementing in their own communities and also in government structures. As you can see, I'm based in the organization of Indigenous People, the OIS, that's in northern coast of Brazil. Yeah. Next slide, please. So, in general, problems among the indigenous groups. So my list could go on and on, but I highlighted the most important ones that we have recognized the last 3 years, certainly on the topic of health, where there is not sufficient recognition of traditional health practices. And that's by saying that is that it's really a clash between the Western medicines and also the traditional way of practicing medicines within our communities. And these methods have worked for many years for our people. And this is also now the time also that we want to share this type of ideas. And certainly coming on to the topic of funding, like emergency funding for different healthcare centers, that is really within the community, really one of the biggest problem, because some communities are quite remote and they have like maybe small medical post, but it's not sufficient or not fully equipped also, and that is what we had recognized also during the COVID period, and it was a disaster for a lot of communities, and luckily ourselves by also getting some support from the French government, and he helped us sufficiently during the COVID period. So it helped us a lot with implementing health strategies within different communities. But even though with the fear of vaccination because of the last in the past experience that the community had with different vaccines and not enough information. This was a big problem also within our community because negative news is spreading faster than positive news. So in different communities, we had these problems by being misinformed of vaccination, of healthcare systems that needed to be implemented in the communities, and certain communities didn't even want to being vaccinated. So in Suriname, like in the case, that was that some communities didn't have enough information, and that's why they had rejected the vaccination campaign in the community. So that was one of the problems that we had. But further though, other diseases that comes also along with the different seasons, I think across whole the Amazon is also like the diabetes, the high blood pressure, the malaria. Those are the topics also that are being forgotten because COVID just wiped all of the other illnesses away. But these are still illnesses that are common in communities. And another thing is also the extreme high cost of logistic within the fields, certainly when in certain regions, like now in the northern coast is now the big rainy season, where a lot of communities are being flooded. So and the logistic is really enormous because sometimes these communities are really remote and have like an airstrip, and it's really all dependent on the rainfall. And if the airstrip is possible to reach. So those are some challenges that I had summed up. Next slide, please. So as you could see here, what the challenges are in the different communities, the floodings, the extreme drought that are since the last couple of 3 years being challenged, the illegal gold mining that are polluting the water. That's also one of the things that are happening a lot since COVID, just like twice and worse cases that we have now, because the miners, they have more access now to different regions. So as you could see, the logistic cost with the heavy trucks trying to support some communities with some food supplies or medical supplies is always a big headache. And sometimes most of, you could say, a quarter of our funding goes through for the logistic. Yeah. Next slide, please. So how the pandemic had affected us was enormously, just like what I said in my previous slide. And yeah, so as we were working the last couple of 2 years, we saw the importance also of our livelihood, certainly in our health, our livelihood, and also in our own community projects that are being affected, being stopped by government, being stopped by COVID cases, being stopped by a lot of facts. So that's why we try to adapt during that period with all our efforts, with all our team, our technicals, our logistic team. We try to face this problem, and as we could see, there are some points again different to difficulties to the difficulties to even having contact with Western doctors because during the COVID period, most of the doctors were stationed in the cities that were affected enormously, and to come even further to think about the specialist, to diagnose if a person needs to be a courier travel to the city, and these were certain difficulties and effects that we had. Yeah. So, as I was saying, certain communities were also quite isolated and in their movement by saying that also that even with the restrictions from the government, communities couldn't go freely more to the cities to get their groceries or get some food supplies that really had affected the communities in their own movement. And also within the COVID, the pandemic period, the negatively and also positive impacts on our traditional knowledge by saying that the traditional medicine wasn't really accepted by the Western society, because communities, what they did, because as how they were quite isolated and they needed to find their own solution, communities had developed their own immune boost medicines that you could see also in the next slide. Can you go to the next slide, please? There are a lot of community started to work with the nature, what they have, and they develop their own immune boost medicines for these typical immune illnesses. And that was really not really right accepted by the Western medicine, because we're telling this as a solution for a lot of communities. Communities were taking their own lead, as you could see here, different pictures from different communities from Ecuador, Bolivia, Suriname, and Brazil, where they took their own initiative to create their own medicine that helped them during that period. Yeah. Next slide, please. So my recommendations are quite a handful, you could say. So as we know from the pandemic, is lesson learned that certain projects really need to be more multiplied, like the climate smart agriculture projects that really needs to apply in the different communities that help the communities by better eating, and that's also one of the points that learned us also with the pandemic, is everything what you eat affects your well-being, your health. So that is really one of the most most important subject also that most of the communities were talking about, is about their health and their food security. Yeah. So another point is also to develop an integrated health model for the communities because that's very important. Just like what I said, certain the indigenous health is not talked a lot on different platforms, and this is really for one to get a climate change project going on. The health of the indigenous is very important because if you're talking about climate change, you're talking about forest protection. If you talk about forest protection, you're talking about indigenous health and well-being. Yes, so this is very important also to integrate these health models within different health subjects and projects. Yeah. Another thing was also the risk communication concerning the public health, as we as POICA saw after the pandemic was going a bit down, other illnesses started to pop up, and like certainly the malaria, the diabetes, and these other typical common illnesses. And this is very important for us within POICA to set up communication, risk communication within our organization, also with the help of you guys. Yes. So another thing is to develop a national and international strategy line and on health actions plan. So this is really important how to act when certain illnesses are popping up a lot in different communities. And this is really also one of the important points that we're working on and also trying to structure. Yeah. And let me see, the next one is structure. Yeah. So having indigenous health strategy to with the help of these different partners in different platforms and to help a strategy to set up a planification to present for the Amazon, to develop a national and international health strategy line and health action plan. This one is the same as the other one. And yeah, so also with saying that, because we as front fighters from the pandemic, we had a lot of challenges, even though we managed to continue fighting for our people, getting supplies to the communities by even putting our own life at risk. Sadly, we even lost one of our board members, that is Robinson from Colombia, one of the directors that was really affected with the COVID, and in 4 or 5 days he passed away. And I want to say this story because it's very important to hear also that even though there is not talked a lot within these different platforms about the health of indigenous, that even though the COICA and our members, our organizations are putting our life at risk also for our communities. So with that said, thank you for this opportunity to talk about the problems and also about our recommendations that we want to work with the different platforms, with the different organizations to have a good well-being of our communities and of our forests and of our indigenous people. Yeah, next slide is the last one.
Thank you very much, Irvin. Thank you for your presentation, and thank you also for raising the voice of our people through the presentation that you just shared with us to the International Alliance of Patients Organizations, IAPO. Now let's move forward to the Q&A session. We have some more minutes. So let's get started with Dr. Sandra Del Pino, and then I'll give the floor to Ervin. I will place a question that will go for both of you. How can we transform Indigenous people? And somehow, within this question, I'm including the relationship between individual and collective rights. So, how can we transform Indigenous people in groups of patients that have a high performance? This is what the IAPO is proposing. The floor is yours, Sandra. Thank you, Mirna. I believe that the foundations of these questions are linked to the work of the agencies. As we're working with technical cooperation, I may say that it's about having a clear framework to work with Indigenous people. It's a framework with rights. I mean, if it's not clear, as we have observed in different practices, there are some measurements that are not very pertinent because due to some lack of knowledge or something like that, we're not applying the correct solution in many occasions. I believe it's a very good question that probably would lead us to start thinking over and over. And I believe that the foundations and the linkage with the health sector, it's only having a clear framework about individual and collective rights. Because if we don't have this, we won't be able to work with Indigenous people. So, digging deeper into some details, I'm thinking specifically about some of the PAHO initiatives, we need to think about how to reach Indigenous structure if we don't have representativeness or if we don't have the necessary structure. It will be very hard to promote spaces to work together. Thank you. Thank you, Sandra. In her presentation, Sandra talked about resiliency of Indigenous people. Irvin made a presentation even with some pictures showing how in the middle of the pandemic, Indigenous people used their traditional knowledge and some other measures to try and avoid diseases, to control the consequences of the disease, and to provide assistance when we didn't have other services. So, Irvin, would you like to share with all the participants today a specific, a concrete example of a community or a group in which you were able to see those efforts and how an alliance, such as the one that is gathering us together today, they could make this ethnicity policy from PAHO possible and effective, which is about respecting traditional knowledge.
Yes. So the projects that we did also with some small funding that we had received. We had also communities were asking also for the support of their own traditional knowledge and their own traditional medicines, and that's where we also as COICA are for and stands for to keep the traditional knowledge also alive, because these traditional knowledge are being kept by the medicine doctors, the traditional medicine doctors of our communities, and they have been using these typical medicines for many, many years of generations, you could say, because this is a ancestral knowledge that's being passed on every generation. So in the case of the COICA, the pictures that I had showed, where even in communities in Ecuador, we had supported them with their traditional knowledge. In Suriname, in Guyana, and in different regions of Brazil. And the METIC helped the communities because of it is more preventive. So is to keep your immune on a better alert system, you could say. But yeah, it is methods that really helped a lot of communities, even the communities that said, okay, we don't want the vaccination, but we want our traditional knowledge and traditional medicine being kept and also being used by the different communities. So these are typical cases that we saw and recognized in our pandemic.
Muchas gracias.
Thank you, Irvin. Sandra, we just received a question. Can the Alliance participate in the WHO and PAHO Regional Committee meeting in Washington in September, October in order to promote the recommendations and discussions that came up in this roundtable? Yes, without any doubts, we can share those recommendations with the PAHO because they will be taken into consideration. Anyways, there is agenda that was already written, so probably the topics for the meeting in September and October were already planned in the previous year. There were some topics already included in the program, so we need to bear in mind that this is a limited space. And without any doubts, I believe that we can make the recommendations and share the recommendations that are pertinent, and us from diversity and cultural area can transmit or share this knowledge with the organization that you'd like to. Thank you. One last question, Irving. You talked about the acceptance problem related to vaccination, specifically talking about Indigenous people. Which are the recommendations or the strategies that you initiated to promote vaccination, or any other strategies that could be used in different cases?
So the strategies that we did were really because the big challenge that we had, the first challenge that we had of the information, most of the information was in the national language, never was in the local language, because it is very important to communicate also certainly on vaccination with communities on their own local language, because that is where the communication is key. And also with our team that we had set up, it was also difficult for us, like certain restrictions. Some of the communities had that they didn't want any foreigner or vaccination team coming in the communities. So these were quite some challenging points also within the communities. What we did, we made a lot of material in the local language by making small animation movies, small animation by even small example is just like even putting a indigenous front leader on a face to speak about this vaccination program. So that was for us very important to implement immediately also because the indigenous lives were quite heavily affected.
Muchas gracias. Thank you so much. We are running out of time now, but it was a wonderful conversation. And now it's clear that we have policies and regulations based on the international human rights. They recognize the health systems of indigenous population. They recognize policies as PAHO, for example, and they allow and they they help with the integration of indigenous people and the traditional knowledge that they have. As Irving said before, some actions are really simple. One of them is using their languages, providing information in an accurate way, simple, integrated to their symbols. Base the work of their own authorities so that they can reduce this gap that comes from the lack of information. So now it's clear that in order to work with patients of indigenous groups, it's really important to have a holistic perspective, respect their knowledges, give them support so that they can create more evidence. It's really important to have these opportunities so through their voices they can share what they're doing, give the right value to that, and keep building alliances as the one that we built with PAHO. It is also important to gather together more and more sectors so that we can really move forward and respect the rights of indigenous population. As Dr. Del Pino said, in FILA we are working with diabetes in indigenous people. We extended the program and now it's not even in Bolivia but also in Nicaragua and Guatemala. And now we included a study that generates evidence of the huge gaps that we have between the indigenous people and the rest of the global population when it comes not only to the communicable disease as malaria, but also the non-communicable diseases. They are becoming stronger because of social determinants of health. It was a really enriching panel. It was a great honor to be moderating the session, and I want to thank the Alliance for giving us the floor, this panel. So we invite you all to keep working with us, members of indigenous groups. We want to work with all of you because you are contributing to help and to change the complex situations we've been facing. Thank you so much to all the speakers and the organizers.
Thank you.
It was a great session. It was unique, and we don't usually have the opportunity to listen to their voices. We say that patients don't usually have a say, and I think that you'll all agreed that it's really important to give them this space so that we can all have the same rights related to health and many other topics. So thank you so much for being here. Now we'll have another 5-minute break and we're almost there. We are reaching the end of our Latin America Patients Congress and we're going to be back in 5 minutes. We are going to talk about primary health care as a basic health system. We are more than 780 participants. So stay with us. Remember to download your certificate. take pictures in our booth. You can share them on Twitter, Instagram, Facebook with the hashtags LAPC 2022 and Congreso Pacientes Latam. All your posts are going to be there. You can check them out. You can visit the exhibit hall where IAPO and IAPO's members have the virtual stalls with all the work that they do. This is going to be available till the end of the Congress, and we'll have a live representative answering your questions. You can know the work of IAPO's member in Latin America through the videos that are available on the auditorium during the break. And see you back shortly in 5 minutes.